The topic we're talking about today is on the National Disability Insurance Scheme and the role we play as a physiotherapist. To give you an overview of what we're talking about, first of all, what is the NDIS? Who is the NDIS for? Who are the role players in the NDIS as far as the providers and the participants? What is my role as a physiotherapy provider? What the responsibilities are as a participant, and what the responsibilities are as a provider. So firstly, what is the NDIS? The NDIS, it's a National Disability Insurance Scheme that's implemented by the National Disability Insurance Agency that provides the necessary supports for individuals under the age of 65 that have a permanent and significant disability. The NDIS allows for access to mainstream services and supports, access to community services and supports, maintains informal support arrangements, and receives reasonable and necessary funding reports. So who categorises for the NDIS? So as I briefly mentioned before, it's individuals with significant and permanent disability under the age of 65 that meet the access requirements of NDIS availability in your particular area. If you fall in the age category, your particular residency, particularly your disability, and early intervention requirements. So if you meet these requirements, then you can become a participant of the NDIS as long as you apply. NDIS availability. So first of all, age. You have to be younger than 65 years of age. Residency. You have to be an Australian citizen or hold an Australian permanent residency visa or hold a protected special category visa. The disability. So you have to have an impairment or condition that is likely to be permanent. You're limited in your ability to participate effectively in activities or perform tasks or actions unless you have assistance from other people or you have assistive technology or equipment other than commonly glasses or hearing aids. You can't participate effectively even with assistance or use of aids and equipment. Your equipment affects your capacity for social and economic participation, and you are likely to require these supports under the NDIS scheme for your lifetime. Early intervention requirements. If your impairment or condition is likely to be permanent and there's evidence that early interventions will help you by reducing the amount of help you will need in the future because of your impairment, increasing or reducing deterioration of your functional capacity, helping your family and carers continue to help you, providing a means for those supports that are most appropriately funded through the NDIS and not through other service systems. If you're a child under 6 years of age with developmental delays, which results in the following: a substantially reduced functional capacity in any of the areas such as self-care, receptive or expressive language, cognitive development's another one, and importantly, motor development as well. If it results in the need for an individually planned, coordinated and long-term provision of care and or treatment, and providing a means for those supports that are most appropriately funded through the NDIS, and again, not through another service system. Okay, the role players. We've got the participants, we've got the carers, we've got family members, the providers, the community, and the NDIA. So the following providers are all part of the NDIS. We've got the doctors and specialists, we've got us as the physiotherapists, nurses, teachers and teacher aides, community health workers, community support workers, transport drivers, builders, allied health workers, counsellors, employment agencies, and psychologists. So what is my role as a physiotherapy provider? So physiotherapy falls under the category of my community and mainstream supports. But importantly, physiotherapists can help with people of all ages and different conditions. We help people take part in the community and be more independent. We're experts at treating children, young adults with disabilities, and adults with disabilities with heart and lung conditions, neurological and musculoskeletal conditions. So more importantly, once we get a strengthening program or help with your condition, what that does is that it can functionally help you get out of bed. It can help you be more independent, taking a shower or bath. It can help you move inside and outside the home. It can help you with daily jobs, sports, or hobbies. It certainly manages pain and chronic conditions. It's an important one. It can lose weight, which then helps you gain more independence. And we can also choose and learn, or help you choose and learn to use equipment such as wheelchairs, walking frames, or orthotics. So to give you an idea or an example of some of the impairments and age groups that we commonly help with is, for instance, a 3-year-old boy with cerebral palsy. We've got 16-year-olds with Down syndrome. There's a 23-year-old with an intellectual impairment, a 30-year-old with an amputation. That could be an amputation of the arm or leg, or even just a half amputation. 46-year-old with a spinal cord injury, or a 60-year-old following a stroke. Now, of course, all of these examples, we could change the age group. It doesn't matter which, as long as they're under the age of 65. Now, we have to have service agreements. So before a provider can deliver or provide a support, they must enter into an agreement with the participant. The agreement documents the supports or services that will be provided, along with the costs, timeframes, responsibilities, and expectations of both the provider and the participant. So if you're not in the situation where you can sign off on these agreements, then that's when your family member or carer plays that role. Now, responsibilities of the participant. So you have to communicate any needs, wants, or goals with regards to the supports you would want to receive. You have to be respectful and polite towards the people that will be helping you. Communicating any problems that you may have. Provide notice if you're unable to attend any particular session. And immediately notify the provider if you wish to end the agreement for any particular reason. And inform the provider if your plan changes or you no longer require the NDIS. Responsibilities of the provider. We have to provide the services that we agree to. Be transparent about the services and supports that we're providing. Explain all the things clearly and make sure that you understand it all. Deliver the service with respect and be polite, obviously. Include the participant in all decision making. And again, that could be the participant, the family member, and or the carer. And inform the participant on what to do if they have a problem or would like to lay a complaint for any particular reason. Again, now responsibilities of the provider. So we notify participants if they want to end the agreement. We receive any feedback and fix the problem promptly if one arises. Ensure all information is correct and up to date. And we must secure any confidential information that's not relevant to anybody else. Obey all applicable rules and laws. Provide invoices and statements for all supports given. Determine whether GST applies. And review whether the agreement is working and whether it will be reviewed. So quite commonly we'll do or particularly a physio, we'll do a service agreement for 2, maybe 3 months. We'll make sure we do an outcome measure at the start and an outcome measure at the end so that we know if you're improving, and then that will help us then come up with a plan for the next agreement.